It takes a lot for us to screen 10,000 children a month. Some of the areas we cover are very, very rural, and the community health workers in those areas have to go great distances to cover the areas that they cover. So they're very dedicated to the work they do. Our two rural dispensaries are much more difficult to reach because the roads are pretty bad. But they're very committed to going to the communities that they've scheduled to go to. The families and the children really rely on these community health workers, and so what they do is really quite important for us. And they really care. They're from the communities that they cover. They know the communities and the families that they cover, and those mothers and the children really trust the community health workers. Our community health workers are an integral part of our healthcare coverage in the HAS catchment area. We couldn't do the work we do without them. We have a group of 42 community health workers. That group of 42 holds more than 300 health posts a month, and because we hold so many health posts, that's the way that we're able to ensure that we screen more than 10,000 children. The community health workers are trained in screening for malnutrition, so they know what indicators to look for malnutrition, and they have basic capacity to give education on nutrition, and they're responsible for finding the malnourished children in the community to send them to us for care. And lastly, that's an opportunity for the community health workers to check up on the status of the children's vaccines to make sure that they have received the vaccines they need by the dates they need to have them. So the child has a health card and everything is documented on it, and they can look very easily at that health card and see, this child needs to have this vaccine, and then they will give it at that point in time. We also use that opportunity to provide vaccines for pregnant women, and we also use that health post opportunity to give vaccines for children who have just been born. With all the services we provide, it still takes quite a bit of effort and focus for our community health agents to screen the number of children they screen. To screen 10,000 children takes a lot of work and organization. And we couldn't do it without the support of our donors here at HAS.